In February of 2014, Facebook added some 50 self-identifying options for its English users, such as transgender, cisgender, gender fluid, intersex, and neither. But why is there a trend in acknowledging the correct gender identity? For many people, gender is simple, clear-cut, and dichotomous. We speak of he, she, and him, her, without thinking that not everyone may feel comfortable with the gender they're assigned at birth. In the medical setting, when the development of sex organs makes it difficult to identify the sex of the baby at birth, their gender is often assigned based on the genitalia that is visibly present. Assigning a gender to a child may interfere with their social development and may potentially cause great psychological harm in the long term. Whether one's gender identity is congruent with their biological and physical appearance is a decision that each individual should make for themselves. So what is the difference between sex, gender, and gender identity? Sex is a biological classification based on chromosomes, gonads, and genitalia. For example, if you have a vagina, your sex is considered female. Gender is a cultural correlation between feelings and behaviors and the biological sex of those that have them. For example, if you belong to the North American culture, you played with Barbie dolls as a child, you're probably considered female. Your gender identity is which gender you feel that you fit into, regardless of your sex. If you feel as though your gender is female, but you have male sex organs, then the sex and gender are incongruent, and as a result, they may identify as male, female, or trans. Gender expression is how you communicate your gender to those around you, through behavior, clothing, interests, or more. For example, people may express their female gender by wearing a dress. The English language has gendered pronouns and gender-neutral pronouns. Gendered pronouns communicate the gender of the individual implicitly, while gender-neutral pronouns do not implicitly identify the gender of the individual. For example, when I say, "I went to the doctor and they gave me a shot," it is unclear what the gender of the doctor is. When using gender-neutral pronouns, most people find it easiest to use the singular they, as in, "they laughed," "I called them," or "their face is red." However, several alternatives have been proposed, including the Spivak pronouns, which replace he or she with a, him or her with m, and his or her with er. Whether or not invented gender-neutral pronouns will be picked up in daily vernacular remains unclear, but the use of the singular they is certainly present in everyday conversation.